Coming up now on Animal Outtakes, how you can help man's best friend grow old gracefully and gratefully. We talk with a veterinarian on how to guide your dogs into their senior years with dignity and compassion. Plus, grief is a lesson of love. We're hearing from a licensed mental health counselor on how you can deal with the loss of a pet, from letting go of guilt to prioritizing the validity of your feelings. Learn what you can do to help you or a loved one through this very tough time. And later in the show, a concept created to help give humans a peace of mind in case of emergency. We're talking about lifetime care and why it could benefit the pets in your household. This and much more straight ahead on Animal Outtakes. Now, who doesn't like puppies? And I certainly get my fill here at Dante's Den. Unfortunately, our four-legged friends age at a much faster rate than we do. But there are things that you can do to help your pups mature in their senior years in the healthiest way possible. We recently sat down with Dr. Pepper in Sarasota, a longtime veterinarian who offers a senior maintenance program, like a lot of the vets do here on the Sun Coast. From diet to exercise to mobility and medication. Here now are some of his expert recommendations. Can you define what is senior status with the dogs?
Kind of varies with the breed. So like giant breeds age at a much rapid rate. So like a wolfhound is maybe a senior around 6, whereas a Chihuahua maybe 10, 11. Medium-sized dogs starting about 7 or 8, they get into so-called senior years. So it varies with size a lot.
Now we watch their behavior up there, of course, and a lot of them are just still full of energy, but others are not. You can see the big change. As an owner of a senior dog, should we be curtailing their activities at a certain time?
Well, I think exercise is important to, have good muscle tone. If they're having issues like with arthritis and that type of thing, there are ways to treat that, to improve that. You're not going to probably cure it, but you can make their life more comfortable. So it has a lot to do with, their behavior, like you say, and how well they're getting around. And some of the newer treatments that are around have been really game-changing as far as helping with arthritis and mobility issues.
Can you tell us a little bit about some?
So the newest things that have come out, say, within the past few years are monoclonal antibodies. And these are made specific for species. So there's a cat monoclonal antibody and a dog monoclonal antibody that is used to block pain receptors in joints. So it doesn't cure arthritis, but it makes it much more comfortable for the patient to operate. And we have seen some really great responses to that. It's an injection, so you don't have to give pills. Doesn't usually have any effect on the kidneys or liver, which some of the arthritic medications you have to follow around with. But it's relatively simple to come in and get a shot once a month. And we've had some phenomenal, in my opinion, since I've been practicing, some phenomenal responses to those, I don't even call them drugs, to those injections. And you're going to see more of that, I think, in the years to come, monoclonal antibody therapy. In humans, they have a lot of it, but I think in veterinary medicine, we're going to see more and more of it as time goes by.
We have also seen some dogs at a young age that are beginning to show the signs of arthritis, have been diagnosed. Would you recommend something?
Yeah, definitely a good option. Certainly have arthritis medications that you can use, but there's not a time factor with those monoclonal antibodies at all. So you could use it in a younger dog. We We have some relatively younger dogs that we are using it in right now. So, and owners have been happy and we've been real happy. Safety factor has been fantastic. It was in Europe. All these products were in Europe 3 or 4 years before they were approved in the United States. And side effects are minimal. I've only had 2 that have quit the injections. Still, safety profiles are really good on them.
Now, food. Should we be changing food as we?
You may have to, you know, diet or weight can make a big difference in their mobility and their other health. You know, just like in people, obesity can make you prone to diabetes, liver disease, makes arthritis much more intense as far as trying to get around. Less weight, easier to get around. Controlling diet and weight, I think, are important in older patients.
Now, I know you have a program for seniors, so we can bring our senior dog in, and what do you do?
Generally, besides the yearly exam and any vaccinations, and I do recommend vaccines in older patients just from the standpoint that their immune system, just like in people, may not be as good, and I think it's important to keep their core vaccines up to date. But we have a senior program where you can come in, you get blood work, which checks internal function, urinalysis, again, checking internal function, kidney function, and x-rays or radiographs to check joints, heart, and the abdomen, see if there's anything out of the norm. And then, if we catch things earlier, sometimes our success on treating those is much better.
Is there anything else that we should know about when our dogs start being senior?
Well, I think just general attention to how their appetite is, how bowel and urine habits are, how do they feel, how are they interacting with the family or their other pets. We do see cognitive dysfunction in dogs as they get older, and there are sometimes some diets and sometimes some medications that will help with that. And then, you want to keep up with your preventative parasite control, real important in Florida.
Is there such a thing as dementia in dogs?
Well, there's not a clinical diagnosis of that. Now, we do have a thing called cognitive dysfunction, which if you want to make a stretch and say dementia may be, but we do see, decreased neurological or cognitive awareness in patients, no doubt about it.
And it can be treated?
There are some treatments. I wouldn't say they're great. They're nowhere near what they have in humans for dementia or, Alzheimer, but there are some treatments, dietary. There's a couple medications you can try. Not always successful. I mean, any of our medications and drugs and stuff, at some point things just wear out and you're not going to be, successful in controlling forever, so. But again, you can maybe extend quality of life if you're successful with medications and stuff. It's always difficult to make decisions on, end of life, that type of thing. I don't know that there's right or wrong answers unless it's something extreme like a coma or something like that. I think then those decisions, but, things like, he's having accidents in the house, doesn't seem to recognize people in the house, kind of wandering, unaware of things, they're moving along, but maybe not the quality of life people would like, We try to improve it, we may or may not be somewhat successful with that. And then, if quality of life is deteriorating a lot, I think then you have to make a tough decision sometimes. So I think as a profession, we're very cognizant of, extending and having quality of life for our patients. So, I think the Sarasota community has really outstanding medical care for pets. Some really good veterinarians in this area. And, some of the specialists we have in the area are just, phenomenally good. You won't do any better at, a university in some cases,
And we love our dogs.
Yeah, for sure. For sure.
If you're in the area, you can reach out to Dr. Pepper's team at fruitvillevet.com or contact your local vet with any questions you might have about senior care. Coming up next on Animal Outtakes, the pain of losing a pet is something that can't be put into words, but it is something you can get through. Some advice from a counselor who specializes in grief. And that's next.
Looking to get away for a few days, but nervous to leave your furry friend? Leave your worries behind. At Dante's Den, we offer safe and secure boarding options for your dog or cat. We know your pet is part of the family, so we provide a comfortable environment with experienced caregivers who offer personalized attention. We have a fully equipped medical facility, spacious accommodations, daily activities like swimming and agility, and staff is on site 24/7. Log on to dantesden.org for reservations.
If you've ever had a pet, you've probably experienced a great loss. And for some of us, it's a pain that may be hard to recover from. But there are resources here on the Suncoast available to help with your journey through grief.
With our society, it's really important that we recognize that pets are really important. Pets can be our family members. We can have a great attachment to them. My name is Crystal, and I'm a grief counselor. I'm a licensed mental health counselor, and I work for Empath Health. I do grief counseling for individuals, families, and also support groups. Many times I support people after the loss of a human, but many times it's really important that they are able to talk about the loss of their pet and their family member or their baby. And people that say, it's just a dog, it's just a cat, it's just a rabbit, etc., they're missing the importance that that pet has on that person, and they diminish the validity of the loss. Pain of pet loss is real because the emotions you shared with your pet were real. The grief that you feel is valid and real because you didn't lose a thing, you lost someone that you're close to. Our pets offer unconditional love, support. They're always there for us in our worst moments. Sometimes they're a reminder that you're someone that is worth loving, that you're important, and sometimes they're a reminder for that, and they're a reason to keep going, to live for as well. So pets are really, really important in that connection that we have for them. I know my dog, Arya, reminds me to focus on what's important. What we do with grief support in a support group is we have a comfortable, safe space to talk about their pet, safe space to talk about, to provide education on grief in general, and the specifics of how pet loss is different, because it is different. Getting another pet, again, is not a replacement. You need to be ready for that commitment again, because it is an important decision, but you're choosing to save another life, but that's an individual, while you carry the love that you have for your other pet. That doesn't go away. It's not a replacement. You don't just move on. You're moving forward and just helping another being, another animal, another dog, cat. It's not a fix for your grief, but can certainly help you to be able to love another dog, another cat, and another pet while you're getting through it. It's just another addition. If it's really disturbing your functioning, if you're noticing not feeling like yourself and it's ongoing and you're having trouble with work, your responsibilities, your relationships, and you just have this feeling like I'm not okay, like something has to happen, that something can be reaching out, finding support, finding a pet loss group or individual session, and talking, being able to talk and having that space where it's non-judgmental, but other people understand what you're going through, that it's real, it's valid, and they're also going through it, that loss and that hurt. If you lost your pet because you had to make the euthanasia decision, that final soft goodbye, just remember that your first rescue brought them joy, and that final rescue brought them peace. You're saving them from imminent suffering and pain, and so it's a loving gesture to be able to make that really difficult decision that we have to do as pet parents. Healing is possible with grief and having that pain. Grief is not only pain, it's also joy, it's also remembering them, the happy moments. It will get better. The pain that you're feeling right now will diminish, will lessen, will transform into something different. You're going to be able to feel joy remembering them and find happiness and be able to and laugh and relive the good times, not just the sad ending.
Planning for the unexpected is usually the logical thing to do for us humans. From car insurance to homeowners to life insurance, the list goes on and on and on. But what about when it comes to your pet? Where would your animal go if something happened to you?
We're seeing a lot more people who prize their pets and want to provide for their care. So there's a variety of ways they can do that. And one of the more popular ways is called a pet trust. A pet trust is simply a legal way, typically a legal document called a trust, that sets forth the pet owner's wishes as to how the pet would be cared for in the future and sets aside some money to ensure that that can be done. There's principally about 3 powerful people that are involved in that. First will be the pet owner, him or herself. Second, there's going to be a caregiver. So that'll be someone that the pet owner picks to be in charge of caring for the pet.
More or less an executor for the,
That's it.
for the dog.
Then we also have what's called a pet trustee, which really is more like the executor, because that person's in charge of overseeing where the money's going and managing the money. And then lastly, we might have what's called a trust protector, not seen too often, but more people are using it to make sure that everything's done right and oversees the process. So the trust protector is someone that may or may not show up in the documents, but the other 2 will be, and that will be the caregiver as well as going to be the pet trustee. But when we do these documents, we want to have some depth in the documents so that we have more than one pet trustee. So we call those successors. Nice to have about 3. I like 3. Same with the caregiver.
Well, it has evolved, hasn't it?
And keep in mind, some pets, like horses, have lives of at least 36 years, because my colleague just lost her horse last month, and it was age 36. But you can see what these horses maybe retire age 12, sometimes 15 or even a little older, but the horse was around for an extra 20 years. If the colleague wasn't available to care for that because she was either incapacitated or had passed away, there was going to be some significant cost to be incurred for Buddy's care. So these pet trusts can get up high in dollar amounts.
When you talk about setting aside the funds, what criteria are you looking for? The first one I would think of is medical.
Yes, that's one of them. We also got to look at a variety of things. One is going to be, what type of pet are we talking about? Fish live sometimes between a couple months and a couple of decades. Parrots and birds, 100 years.
Forever.
Forever, yes. So that's the life expectancy. 2 is going to be with regard to how much money you think you're going to need for their care. That would be including the veterinary medical care. Housing. So for a horse, people pay upwards to over $1,500 a month to board their horse. Some pay much more than that. Do that for 12 months. You're into some serious money.
Yes.
Do it for 36 years. Now you're going to need a job to be able to pay for all that. Yeah. But these are some of the easy items to look at with regard to making that.
We look at canines. Of course, we have many different breeds. But we would hope that most of our canines would get to between 12 and 14 years of age, whether they be a large breed or a small breed. We're talking some substantial funds there. And then, of course, as you point out, with medical, the pharmaceuticals that we have to use for the dogs out at Dante's, we have seen a 40% increase in meds in the last year.
That's outrageous.
It is outrageous, but you have no choice when you're going to administer to these dogs. So How do you counsel these people? Because I'll tell you what I've heard. This dog is my family. He means everything to me. And then we start to discuss along with you, well, this is what it's going to take. And this family member starts to get a little bit more like a phantom all the way back.
In fact, 90% of cat and dog owners consider their pets family members. So this is a tricky business because what you're trying to do is how do you allocate money to the pet care, at the same time allocate money for the owner's care, him or herself. If they end up in an assisted living or a nursing home, the money could be burnt up pretty fast. So the key is that what type of planning are the pet owners doing? And they really need to look at something called asset protection planning to make sure there's going to be enough money for everybody.
Tell us a little bit about
So
that.
to me, I favor the trust-based plan because I can have planning when someone's alive, becomes next phase of life's incapacity, and the last phase of life is when they're dead. So the trust works in all three phases, which is nice. And for our older clients, as a certified elder law attorney, most of my clients are in their 70s, 80s, and a lot of them have pets, and is their primary reason for even sometimes living because they love their pets. So when we do the plan, we want to make sure that there's sufficient fiduciaries or agents going to be available for the take care of the pet, put aside enough money for the pet, but also have a plan in case someone has to leave their house to live in a facility. That's when that pet trust provision could kick in to make sure there's money for the pet.
What would you suggest for the average person when they do get a dog? They need to plan.
Yes. Now there's a variety of ways to plan. When someone's 18, in most states they're considered an adult. So we always recommend they at least have a power of attorney or durable power of attorney, as well as some health care documents in place. We're always planning for someone to become incapacitated. That could be a result of an illness or an accident. No one wakes up and says, I hope I have an accident today. So what we're trying to do is put a plan in place. It's in writing, not verbal, in writing. All this is geared to avoid a guardianship. And you don't want to be typically involved in a guardianship. That costs almost like $5,000 to $7,000 to get underway. And we don't do that here in our law firm because we only practice happy law, Marcia. That guardianship, in my opinion, is not happy law. So without having that power of attorney in place, and then that power of attorney, you would have a provision to care for the pet. You could have it written in more detail or simple, but we always want to have that in the power of attorney. Then as far as protecting or setting up money aside for the pet, then that typically is done either in a will. And remember, the trick with the will is that must go through probate. So many of the people we meet do not understand that. They're not aware that if you have a will, you're going through probate in order for the will to work. Now you have a delay of time. So what's happened to the pet in the interim? They need to eat that night. So when someone dies, that will may not be probated for a couple of months. So what's the plan of attack for having the pet cared for? We have a problem. The trust comes in to save that situation. So that way, when someone dies or becomes incapacitated, there's a mechanism to hand over the control to this fiduciary called the pet trustee. And now that pet trustee can manage the care for the pet, including the medical needs.
We thank Kevin for his time on this important topic. If you have questions about your particular situation, no matter what species of animal you have, you can contact lifelawfirm.com. Animal Outtakes is produced by Dante's Den Foundation, a nonprofit group dedicated to creating the best life for dogs. If you would like to learn more about Dante's Den, donate, or volunteer, visit our website, dantesden.org. We here at Dante's Den have experienced loss also, and it doesn't get any easier. It just takes a piece of your heart. And so when we think of these dogs, we think of them fondly and beautifully and gratefully that they crossed our lives and came into our heart. Thank you for watching.